because I think the people that are still within the NHS are just like, I'm trying to think of a good example. They're basically like the band in the movie Titanic who stayed on way beyond past their time.
Gentlemen, it has been a privilege playing with you tonight.
Look, there's no other way of putting this. The NHS, the UK health system is failing. It's collapsing. It's pretty much on life support. And this is going to be a slightly different video to the rest of the videos on this channel. It's more of an honest take from somebody who works within that system. It's going to be less hard facts and more my opinions as to why I think it's failing. There's four themes I've written down here. Let's dive into the first one. So I've been a doctor in the NHS for 14 years, and over that period of time, I think one of the key things I've seen is chronic underfunding. This has just led to a system that is malnourished, that is not really reaching its potential and never really will. If you look at the comparison between other European countries, you'll see that the amount of money that goes into the NHS is far less, and we actually give a good kind of account of ourselves. The efficiency is actually pretty good, but actually the amount of money that should be going in should be far, far more to keep the system afloat, to keep the system running. And so it's not surprising that when you look at it, our waiting times are getting higher, whether it's A&E or whether you're trying to see a specialist, especially after the pandemic, or mental health services, particularly for children. And if you look at your GP, your family doctor, they get about £160 from the government per patient. So that is like the equivalent of a Netflix subscription for a year. And those patients can book in an appointment every single week or 2-3 times a week. And people are living longer with chronic illnesses, with nursing staff that need to go out and see them, with matrons. It's just a lot to expect for that amount of money. Okay, on to number 2, and I've got bleeding of staff. The NHS is really struggling with keeping and retaining numbers. We are bleeding out staff left, right, and centre, whether it's nursing staff, whether it's paramedics, GPs, doctors, anything. We have got a lot of rota gaps. And there's lots of reasons behind it. You've got a post-pandemic effect where there's a lot of burnout, there's illnesses, there's long COVID, but also there are key things that I think just cannot be ignored. If you look at it, the wages that we pay our staff are not good enough, from healthcare assistants to nurses to doctors. We are in the midst of a cost of living crisis, but if you take into account the amount of training we've had as doctors, I started my training back in 2006, so it's been 20 years to get to this stage. And if we fast forward to 2024, it's stayed about the same, maybe dipped a little bit. The other thing is, I sometimes, don't ask me why, but I have a look at Daily Mail articles and I go into the comments just for a little bit of dose of reality, if you like. And I do get the sentiment that doctors are paid well and GPs get paid too much and X, Y, and Z. I can understand it really, because people are struggling to put food on the table for their families, and as GPs, we don't have that struggle. My parents were about 30 years ago when we came to this country as refugees. They were working 2 jobs, a daytime and an evening job. And I was the age of 9, 10, looking after my brother, 2 years old. Don't tell social services, it was character building. But that's real struggle, and that's real hardship that people are going through at the moment. So I could get the sentiment, somebody who's in that situation may look at this video and say, well, doctors get paid well enough, what are you complaining about? My argument isn't about that. My argument is that just because you're getting paid well doesn't mean you're getting paid fairly. And it's that aspect. I don't think it's been fair, the progression of wages, the amount of time that we've put in. I started medical school in 2006, pretty much gave up my 20s to study medicine, to train as a junior doctor, doing crazy 12-hour days at times, 7 nights in a row. And it's not really a sob story. I enjoyed it. It was tough, it was grueling. But most doctors will come out of that training with 50 to 100K of debt, with no option of buying a house at the moment with the current financial situation. And I think if they want to have a fair wage, then power to them. They should be able to absolutely fight for that, because I think in this world, if you don't fight for the things that you want, nobody else will. And I think that's why we are seeing an exodus of doctors to Australia, Canada, New Zealand. We have to kind of ask ourselves, well, what is it that isn't quite right that is doing that, instead of just filling that gap with international medical graduates or physician associates and AMPs. Quick doctors are leaving will, kind of cover the cracks. And the reality is, in the UK, you probably see 30 to 40 patients in a day. You have 10 minutes per appointment. In those countries, you probably see 20 to 25 max. You have a better work-life balance. So everything about your work and how it's set up is better. So why would people stay? And that's a very difficult question to answer, especially if you see policies brought in by the government. Like, let's talk about one, for example, the ARRS funding system. Essentially, it allows GP surgeries to bring in physician associates and nurse practitioners to fill in gaps within primary care. And essentially what that's done is a GP surgery will get that member of staff for free because the government pays the wages, whereas previously they would have probably needed a locum GP to do it. Now, the expected thing would be that a partnered GP or a senior GP would need to monitor them very closely. But in the practices I've worked in, physician associates had just been dropped in. I'd sometimes leave at 6 o'clock and have a look at the door of the physician associate who'd be stressed out their head. They'd still be there for another hour later, wondering whether they'd made a mistake. There wasn't that support from like the senior team, and it wasn't quite right on that person. That person had had maybe 3 years of university and they were out of university for 1 or 2 years. So the experience level was not there. I don't think it's safe for the patients, and it wasn't even safe or fair for that physician associate. But that's what happens when you give free service to a surgery, because for them it's a no-brainer. Of course they'll take on another clinician who can see patients when there's no regulation for them to be followed up very, very closely by a senior doctor. So what are GPs and doctors doing in general? Well, there's no surprise, because they are leaving for Australia, New Zealand, Canada. They are moving on to other types of work. Myself, over the last year, just because locum jobs have been lower, I've gone into medical advisory for medtech companies. I'm on Upwork doing that kind of stuff as well. It's about diversifying what we do, because what used to be the role that we were doing is no longer there. Okay, on to number 3, and I wanted to talk about this one because it's the post-pandemic fallout. We already had cracks in the system, but the pandemic was almost like a flood of water hitting a dam. The cracks that were already there under the strain of the pandemic really began to show, and we are still seeing the effects to this day. And the thing that was the most frustrating aspect of it was seeing politicians do these multi-billion pound contracts with their mates and donors and associates, get no punishment for it whatsoever. Billions of taxpayers' money destroyed because PPE was out of date, unusable, and no punishment, no accountability. But if a doctor uses his wife's Oyster card, that's the card we use to use the underground in London, well, he gets a 6-month suspension. The double standards in that really frustrates me sometimes about the society we live in. Okay, on to the last one here, and I've written down aging population and chronic illnesses. The health challenges of 20 years ago are not the same as they are today. We are seeing a rise in obesity, we're seeing a rise in cancer diagnoses, we're seeing a rise in chronic illnesses. We're also seeing a social care system on the brink of collapse also. When you go to hospitals, you'll see on a ward round often, it literally will say, patient is fit for discharge, awaiting social sort out. So awaiting for social services to get a package of care. And this is what's happening with an aging population. As people live longer, they are living with chronic illnesses for a longer period of time, and they are needing more and more support from their doctors, which is why you'd think you'd probably put in more money into the system. I don't know. Sounds like a good idea, but who knows? I'm not a politician. On the other hand, as GPs, we have 10 minutes per patient. We're seeing more complex patients day to day. Used to be that we would, in a 30 patient a day clinic, see a couple of coughs and colds. But now that we have other allied professionals working with us, they tend to see the less complex ones, whereas we are getting majority complex patients. And that in 10 minutes is impossible to sort out. And that's actually one of the reasons I started this channel, because I knew that when it came to lifestyle medicine, in trying to educate the patients that I see day to day, I would never be able to do that in 10 minutes, and I would never be able to give that justice. You can talk to people quickly, maybe you'll get some of it, but to be able to do it in a relaxed and easy manner, that takes half an hour. And that's why I make these videos on here, and that's why I've got a blog at drkhalid.com about health information and how you can stay healthy. But probably on a weekly basis, I'll see people abuse reception staff, nurses, doctors, and it's not the fault of the people within the system that your waiting time to see a specialist is 3, 4, 5 months. It's not the fault of the people within the system that you're having to wake up at 8:30 to call call in and be on a long queue on a telephone line. I know how frustrating that is because I've had to do it for my son the other day. And the more we blame the people within the NHS, the more toxic and negative that environment is, and the more of those people will leave. Because I think the people that are still within the NHS are just like, I'm trying to think of a good example. They're basically like the band in the movie Titanic, who stayed on way beyond past their time. They're probably allotted for like 2 hours of music playing, and they stayed beyond. They were like, we are gonna play the music whilst this ship is sinking, and the NHS is sinking. So I would say don't blame them. Write to your politicians, write to your MP, request that the NHS gets the right funding, because I think it's a beautiful system and it absolutely deserves that.